intro. So I work in diabetes education at North Kansas City Hospital. I work in inpatient and outpatient education. My husband actually has type 1 diabetes, and my mother-in-law has type 1, and my father has type 2. So this is something that I not only work with, but I also live with every day, and it is a real passion of mine. So I am glad to be able to talk to you today. Please feel free to ask questions, but we're going to start from the very basics of diabetes and go through some treatment options as well. If I can get this, there we go. All right. So there are 4 main types of diabetes. It is a lifelong condition that sometimes can be managed with dietary and lifestyle changes. But once you have this diagnosis, it's not going anywhere. However, it can be managed often with diet and exercise, and sometimes addition of pills, sometimes addition of insulin. So you have prediabetes, which is over here. I don't know if you can see my little cursor, but prediabetes is on your left. And that's when your blood sugar is a little higher than normal, but not what we would classify as diabetes. And the key to that is that it is actually a turning point at which we can prevent the development of diabetes. So we'll talk about the A1C, but keep in mind that prediabetes is an A1C of 5.7 to 6.4. Okay, and we'll come back to that in a little bit. So type 1 diabetes is mostly thought of as juvenile diabetes. Okay, this is most common occurring in children. It's only 5% of diagnosis of diabetes, so very, very tiny percentage. But in this case, your pancreas, which we'll talk about, is supposed to make insulin, but it doesn't. This is an autoimmune disorder. And so for patients with type 1, the only option is for insulin. Okay, so keep that in mind as we go through treatment options, okay? Now, diagnosis of diabetes is anything with an A1C greater than 6.5. So remember, prediabetes over here on our left side of the screen, that is when your A1C is between 5.7 and 6.4. Once you cross over into 6.5, that's considered diabetes. All right, now that's the same number, 6.5 for type 2 diabetes. So type 2 diabetes occurs when a person's body makes insulin, but can't use it properly, can't use it effectively. And so that's when pills are most effective. So with type 2 diabetes, this is when there's a possibility of dietary and lifestyle changes, possibility of pills, and sometimes insulin's required. With type 1, pills are not useful at all. Okay, so keep that in mind as the difference. Now, gestational diabetes isn't applicable for a lot of us. This is when you're pregnant and your blood sugars are higher than normal. This is a hormonal complication. So when you're cooking a baby, basically, right, when you're developing that baby, your body produces all these hormones to get the baby ready to come out. And as it does that, it makes your cells insulin resistant. What that means is it just doesn't produce insulin. It produces insulin, but it can't use it well enough. So now that we kind of have those definitions, let's jump back to what insulin is, what it does, and where it comes from. So before we dive into this diagram, insulin comes from the pancreas, okay? And I don't know if you guys can see me, but I have a picture here of the pancreas, okay? The pancreas is only about 2 inches. It's really tiny. It's about this big, okay? And it produces lots of different hormones. Insulin is just a tiny amount of what it produces, maybe 5% of what the pancreas does. But the pancreas is most well known for insulin production. Okay? So insulin is secreted specifically when you eat carbohydrates. So if you eat foods And we'll talk about carbohydrates in a little bit, but foods that are high in sugar and starches and breads, pasta, all that good stuff, right? There's a hormone in your stomach that tells the pancreas, hey, we got some good stuff in here. And then the pancreas secretes insulin. Insulin then acts like a key, as you can see here, and that key unlocks all the cells in your body. So your muscle cells, your fat cells, all the mechanisms for all of your organs, even your brain cells, okay? They have to have insulin to open up that door. Now, remember those carbohydrates that we were eating? They break down into sugar. And that sugar can then go through the open door of the cell. So insulin opens the door for blood sugar. Okay, so that sugar goes in and then it's converted into energy. So that actually brings us to the most common, hold on, oops. Okay, sorry. The most common symptom of high blood sugar, which is actually fatigue. So if you can't open up those cells, if you don't have enough insulin, if you don't have the right medication, all that blood sugar can't get into the cell to create that energy. So you're going to feel tired. Your brain is going to feel lethargic. You know, it's going to feel tired and a little slow because it can't use the energy that you're consuming. So that's the basic idea of insulin. Now, remember how I said type 1, you don't produce insulin anymore, okay? So take that key and throw it away. That doesn't exist anymore, okay? Now type 2, instead of that one lock that you see right here, your cells then have 2 or 3 or 4 locks, okay? This is because of several different reasons. One reason is inactivity. So the more inactive you are, the more we sit around on the couch. I know COVID is one of those big life changes, right? We're sitting a lot more, we're watching a lot more TV. And that actually basically puts more locks on those doors. And the reason is your muscle cells, this is really fun, your muscle cells can use sugar without that key in certain situations. Okay, so I know that I told you every cell needs it, but when you are actively using your muscle, so the guys who are pumping iron, right? The women who like to jog or men who like to jog, all those different activities, anytime you're actively using your muscle, including going for a walk, those muscles can all of a sudden open the doors and use that blood sugar. Okay, so now when you're inactive, your body's not using as much sugar, so the cells have to open up more often, so they need more keys. Okay, so that's one reason. The other reason is recently, scientists discovered that when you gain weight, you don't actually gain more fat cells. Your cells just become bigger. So if you think of it like an apartment versus a house, right? An apartment has one door, or a room has one door, but your house probably has a door to the garage and a door to a front door and a back door. It might have a door to a deck. Okay, it might even have a kitchen door. All of those require keys. So as your cells get bigger, they require more keys. And that's essential to understanding type 2 diabetes. Okay, so we've talked about inactivity, and we've talked about insulin. We've talked about gaining weight. All right. Now, here's the last component. If you eat lots and lots of carbohydrates all the time, okay, so think of it like coffee. So, cups a day. And if I stayed up a little too late studying or doing anything else, I needed 6 or 7 cups of coffee the next morning to really get me going, right? Because you get used to it. You create a tolerance for it. But over time, I decided that, okay, not hating on coffee or anything like that, but I decided that 7 cups of coffee probably wasn't good for me, right? You can all agree that I shouldn't drink 7 cups of coffee. So I slowly decreased the amount of coffee that I drank. Now, if I were to drink 7 cups of coffee, I would be so hyper. I'd be crazy hyper. Now, if I stay up too late, because my husband and I are really into we watch a lot of nature documentaries. So we're watching this nature documentary and I stay up too late. So the next morning, I only need maybe 2 cups of coffee to really get me going. So that was a long example, but that explains how the body gets used to all this extra sugar. And it becomes almost tolerant of that sugar and therefore excess insulin. Because your body does produce more insulin when you have more sugar. And so over time, these cells just need more and more and more insulin. The nice thing is, just like my reduction of coffee, you can actually reduce the amount of carbs you eat or carbohydrates, sorry. Reduce the amount of carbohydrates you eat, and that'll actually make your cells use insulin better. They'll require less insulin. So there are 3 major components, okay? And we'll talk a little bit about medications later on and how they work in those same ways. All right, how do we tell if you have diabetes? So you've probably heard of different ways of identifying if a patient has diabetes. There are several different, sorry. There are several different ways you can tell if you can determine if a patient has diabetes. The most common is two tests together. Okay, so number 1, you'll come to your doctor's office and you won't have eaten anything. They'll tell you don't eat anything after midnight. All right, and they'll prick your finger and they'll see what your blood sugar is. That's called a fasting blood sugar. All right, the next way is a hemoglobin A1C. This is often shortened to the A1C test. This is run on a lot of patients. Now, if you're younger, it's probably not run. I think it's not, 55 is young. So around 55, we start monitoring this every 2 or 3 years. But if you don't have any symptoms, which we'll go over, your physician may not even check this for quite a while. Okay, but it is really important when you get over the age of 55 or 60 to have this checked, because it will determine when you need to start making changes. Okay. Now, if you make changes now and you don't have diabetes, you could push that off for a long, long time. Okay. Now, a hemoglobin A1C is a 3-month average. Now, I once had a patient ask me, who's sneaking into my room every night and checking my blood sugar to get this average? We don't sneak into your rooms, I promise, okay? The way we get this is that red blood cells, as you'll see on the left under category 1, the red blood cells live about 3 months in the body before they're recycled. And recycling happens in the spleen, and they break down and take the nutrients and make new red blood cells, and waste product goes out, okay? But those red blood cells live about 3 months in the body. Over that time, excess sugar, so any sugar that can't go into the cell, like we just talked about, right, stays in the bloodstream, that excess sugar sticks to those red blood cells. Okay. So then when we draw your blood sugar, draw this A1C, this could be a lab draw, so they could stick a needle in your arm, or some physicians' offices can do it with just a finger stick. Then we can see what your 3-month average has been. So that is a better measure for diagnosis than just you checking your blood sugar at home. Because your blood sugar at home only tells us at this exact moment, regardless of everything happening in your life, what is your blood sugar. But an A1C tells us your ups and downs, your feast and famine, you're staying on your diet and not staying on your diet. It tells us all of those numbers combined into one. And it really gives us a good idea of what your blood sugars run on a regular basis. Okay, and so that is why it is used for diagnosis. So this is our A1C chart. Remember I said type 1 and type 2 are diagnosed in greater than 6.5. That is the equivalent of your blood sugars running 154 most of the time. So sometimes they'll get lower, well, 145. Sometimes they'll get lower and sometimes they'll get higher, but most of the time it's around 145. Now, without diabetes, your blood sugars are going to run about 100 all the time. So you see, it's not a huge difference, but it's enough to impact your body. And we'll talk about the impacts of that in a minute. So above 7% is when we see the most damage from elevated blood sugars. So you can see if your blood sugar is running 300s all the time, that's going to be a little bit of a problem. That's much higher than not having diabetes. When you have diabetes, the goal is to reduce that A1C back to lower than 7%. All right. And so this is our happy place, less than 7%. Now, if you are 85, you know what? There's a little bit of leniency there. We'll give you a little bit of extra room, and it's okay if you run above 7%, as long as you're in between 7 and 8%. Because this number actually, besides telling us if you have diabetes, is a really good indicator of your quality of life. If your A1C is above 8%, you are going to start seeing those everyday effects of high blood sugar. And again, we'll discuss those in a minute, but it really does make a difference. And most importantly, we want to improve your quality of life. We don't want you to be tired. We don't want you to have all those symptoms, because who wants to live for the next 60 years with all these different symptoms and complications, right? So that's the ultimate goal. All right, so complications. Remember back when I told you those that sugar sticks to red blood cells? Well, red blood cells are supposed to be more like a lava lamp or Jello. There was a drink back, I don't know, 20 years ago called Orbits, and it had these little jelly balls that floated in it. It was terrible. It was the worst drink ever, but I wanted one so bad. I just wanted to drink them all the time because they were really cool. They tasted really terrible. Anyways, side note. The idea is that your red blood cells are supposed to be squishy, and they're supposed to move and change shape slightly so that they can get into the tiny vessels in your body. Okay, so you have small vessels in your brain, in your heart, in your feet and your hands, in your kidneys, and in your eyes. So over time, if those vessels get covered in sugar, we actually call this candy coating. It's not a scientific term, but we call it candy coating, to where the outside of that red blood cell becomes hardened to some extent. Well, once it's hardened, instead of like Jello changing shape, it can't get into those small vessels. It can't squish down and ooze into those small vessels. So that's when we see this damage to different parts of your body. The first areas that we see damage in are eyes and feet. Okay, so eyes, patients may experience changes in vision. You have a higher risk of cataracts and glaucoma, and there's a tiny risk for what we call aneurysms in the eye. And that can cause blindness over time. All of us know someone who we can say, oh, diabetes caused my aunt to go blind, or my cousin to lose his foot. Okay. So that's what we're talking about, is we're talking about the damage to those vessels. Now, it's important to understand that red blood cells carry oxygen, and oxygen and nutrients are taken to these different areas. So if those nerve cells can't get oxygen, then they're going to have damage. The goal is, if we can keep that A1C down and keep those red blood cells jelly-like and squishy, then we can reduce the risk to you and to all of your different parts, to that of somebody who doesn't have diabetes. We just need to help you get those blood sugars down and the A1C under control. All right, any questions so far? Okay, well, I will just keep talking. If you have questions, please let me know. It may take me a minute. Apparently, I have to pull up those little side thing to see those questions. I'm still new to this type of Zoom. Okay, so next, maybe next. Ha, okay, symptoms of high blood sugar. How do you know if you have diabetes or if you should talk to your doctor about diabetes? Well, number one, I don't think it's ever a bad idea to ask your doctor, do I have a risk? Do you want to test me? I think that's a really healthy, conversation to have with your physician. But also, if you start to notice the first things are being tired all the time, so extreme fatigue, okay, and extremely thirsty, so you drink and drink and drink all day and you're never satisfied. The other one is frequent urination, so you're peeing all the time. Now this gets into kind of a cycle of self-explanation. So I think, well, I'm thirsty all the time. It's hot outside. I mean, yesterday got up to 90 degrees, right? So I was drinking all the time. So of course I had to pee all the time. Well, I started peeing in the night because I was drinking so much water. And so that's why I'm tired. Do you see that cycle, that circular understanding of it? So that's why it's often missed, is because people explain it through those different complications. Now, over time, you may start to feel hunger. You may lose a lot of weight, notice decreased healing, and have some numbness and tingling in your hands and feet. Okay. There's also blurry vision, and that's typically when your blood sugar spikes really high. Okay. So over time, these things can start to happen. Now, hunger is an interesting one, right? Because you would think, oh, I have lots of sugar. Why would I be hungry? It's because your body can't use what you have. So it's actually called starvation in the presence of plenty. So you have nutrients available, but you can't use them. All right, now the opposite of that is hypoglycemia or low blood sugar. Some people actually with diabetes will say, you know what, when I was younger, I dealt with low blood sugar all the time. My husband has this history as well. And then sometimes you don't even have to have diabetes, but all of a sudden, that Snickers commercial? It's like that. All of a sudden, you're grumpy, you're really hungry, you don't want anybody near you, you just need to get food, and you can't explain why. And sometimes that's just low blood sugar. Now, low blood sugar can it can occur outside of diabetes, but it can actually occur with diabetes medications or when you have to take insulin. Because the idea of those medications is that your body is using your own insulin better, or you're getting additional insulin. And insulin allows your body to use sugar, so it decreases the amount of sugar available in your bloodstream. So that can cause a fast heartbeat, that can cause dizziness or shakiness, it can cause sweating. I know from personal experience, my husband will turn sheet white, just completely pale, and I know he needs something sweet. So we'll talk about ranges here in a second, but low blood sugar is anything less than 70. Now, a lot of people are fearful of low blood sugar. It does not feel good, and it can take a little while to start feeling better. But the emergency is after about 40. When you're between 40 and 70, you should absolutely do your best to fix your blood sugar, to bring it back up. But under 40 is when you start to see people pass out or start to get really confused and maybe lose consciousness. Okay, so that's low blood sugar. So we have both the highs and lows. The goal with diabetes is to keep your blood sugar right in the middle, and that seems unfair right? That's why diabetes is such a difficult disease. Everybody can say, oh, I'm just trying to lower my blood sugar or my blood pressure. Oh, I'm trying to lower my cholesterol. Nobody ever says keep your cholesterol between 10 and 30, right? They just tell you it needs to be below this. With diabetes, we're telling you it needs to be between 70 and 130 before a meal. So that's why it is something that weighs on patients all the time and can get very overwhelming at times. Okay, so how do we treat this? I know I talked about medications, and we'll talk about those again in a minute. But the primary thing that you're going to discuss with any physician with a new diagnosis is healthy eating. So what do we recommend? First of all, let's look at carbohydrates. Carbohydrates, remember I said that they turn into sugar in your bloodstream, and then they turn into energy. Well, fats and proteins don't do that. Yes, a little bit of fat will break down into energy and a little bit of protein will, but mostly it's carbohydrates. Okay, so that is why in diabetes we focus so much on this one tiny bit of nutrients. Okay, so I know that everybody's heard of complex carbs or simple carbs. And I'm going to flip to the next slide and we're going to pop back to this one. Okay, so don't worry about the chemistry of this. I mean, I don't know if they're carbons or something. Don't worry about that. The important thing of this is look at how small the simple carb is. It's one little, we're going to call them stop signs because they're hectagons, okay? It's one little carb piece. A complex carb is 5. So what that means is that it takes your body so much more energy to break down those complex carbs than it does the simple ones, which means, okay, remember, carbs break down into sugar. So if you have a simple carb, it is broken down like that, and all of a sudden your blood sugar is skyrocketing. But if you have a complex carb, your body actually breaks down one at a time. And so your blood sugar, instead of going up and down, is going to go just a gentle curve, like a wonderful hill. Okay, we're talking like Kansas, Missouri hills, not Colorado hills. All right, the simple carbs, Colorado hills. So that is the major reason we say to focus on complex carbs. So complex carbs are things like beans, fresh fruits and vegetables, whole grain, pasta, bread, cereal. Oatmeal is a great complex carb. Okay, those things take longer to break down. And that's why, you know, a lot of people will say, I eat oatmeal and I'm full all day. It's because your body breaks down those carbohydrates slower. Now, on the other side, you have your simple carbs, and they are like soda, donuts, which I personally love. Okay, so I love bagels. That's my thing. My body doesn't react well because it peaks so quickly, and then my body says, oh my goodness, you have so much sugar, we're going to give you all of this insulin. So my body actually overcorrects. It goes a little too far, and so my blood sugar drops too low after I eat a bagel. So that's because they are simple carbohydrates. All right, juice works the same way, candy, those sweets, all white breads and white cereals, all of those things are going to spike your blood sugar and then come back down. Now, if you don't have the right amount of insulin, or if your insulin isn't working properly, your blood sugar is going to spike really high, and then it's going to take a really long time to come back down because now your body is working overtime to correct that sugar. Okay. The other thing is fiber actually, one, breaks down for a really long time, and not all fiber turns to sugar. So that way, if you have something that's whole grain, those complex carbs that has fiber in them, it actually takes longer to break down, and some of it may not even break down. And that's why it's really good for going to the bathroom regularly. Okay. Now, fats is important, and that's because remember how I said diabetes can increase risk of heart disease. So if you're eating bacon, we're talking like a whole package of bacon every day, that's going to increase your risk of heart disease, and you already have a slightly higher risk. So watching how many fats and oils and what kind of oils you eat is very, very important. Okay. So overall, reading a nutrition label is great. If you are comfortable looking at your nutrition label for things, that's amazing. The typical range is 45 to 60 grams per meal. Now, some people say, oh, well, I'll just, save all those up. Don't do that. You're not allowed to. You can't save them up. They are basically, they need to be broken down each meal. Okay, so you want your blood sugar to actually look kind of like a roller coaster where you go up and come down and up and come down. And that's actually how patients without diabetes function. Their blood sugar goes up at a meal and then it comes back down to a nice curve. So you want to look at those total carbohydrates, and 45 to 60 is a very healthy range. Okay, but again, don't skip lunch and eat 120 at dinner. Okay, now, oops, the next one and the next one. Say you go over to your aunt's house or your sister's house and she makes you food. You're not going to dig through her trash and look at her nutrition labels, and I don't expect you to. I would never ask you to do that. Your goal instead is to look at your plate, and a quarter of your plate, just 1/4, is your carbohydrates. And now, I understand that if you look at a potato, that whole potato isn't carbohydrates, right? But we're talking foods that are high in carbohydrates. They need to fit into that 1/4 of a plate, all right? So eat as many vegetables as you want. You can have avocados, which are actually good for your cholesterol. You can have tomatoes and peppers and broccoli, cauliflower, carrots, celery. There are all sorts of things now with celery instead of potatoes. I understand it's not the same. And I have some holiday tips for you if you're interested. But all those vegetables, fill up on that. And here's the thing. I love to cook. That is my stress reducer. I bake and I send cookies to everyone in my family and candy to everyone. And I told you my husband has diabetes. So this is a little bit complicated for us. So what we do is we just make sure that we have this balance of what we're eating and the small amounts that we eat. Okay, high fiber things, improving the amount of vegetables we eat. All of that is key. All right, protein. Obviously, low-fat, lean protein is going to be better for you, but you do still need some fat in your diet. I actually saw that my LDLs, so my low-density lipoproteins, or bad cholesterol, in case you're wondering, bad cholesterol, was 103. Now it's supposed to be under 100. So as a diabetes educator, I had a tiny little panic attack. And I came home and I told my husband, this is terrible. I don't know what I'm doing with my life. What am I supposed to do? I then spent the next 2 months looking up all the different ways to lower your cholesterol. Avocados, great one. Okay. Soy milk. Now I know there's a lot of concern about soy milk, but a little bit, so in moderation, can be really good for you and helpful for you. Flaxseed is also really good to lower your cholesterol. So I actually took flaxseed, ground flaxseed, and I mixed it with a all-purpose seasoning like Mrs. Dash. And now I sprinkle it on my salad. So I get a little bit every day, but I don't have to just spoon eat flaxseed. I don't think that's a thing. But don't do that. It probably tastes terrible. But I still get that in my diet. So the key is moderation. The key is also enjoying your food. So say you hate salad. That's fine. I enjoy salad, but not everybody does. Eat your salad first and fill up on that. And then enjoy the potato that you're going to have. Enjoy 1 piece or 2 pieces of pizza. Okay, but don't eat those foods to fill up, because what happens when you eat those foods to fill up? You like shovel them in your mouth. You're so hungry, you just put them all in, and then you want more because you like the flavor. So eat something else first to quench that hunger, to push that hunger down, and then savor, really enjoy that pizza or that other food. I love pasta. I love mac and cheese. You only get so much. So enjoy that. Save it for last. We had an employee appreciation dinner yesterday at work, and they provided us with cheesy corn. I love cheesy corn from Jack's Stack. Now, I made the poor decision of eating it first because I didn't want it to get cold, but then I immediately wished that I had saved it to last so I could just sit there and enjoy it. Okay, so that's the key. All right. Physical and mental health. So, 1, stress can increase your blood sugar. It's not going to cause diabetes, okay? It's not going to increase your blood sugar by 2 to 3% on your A1C, but it can impact it over time because stress makes your body release a hormone, and that hormone causes insulin resistance, like we talked about with type 2. So finding a healthy way to relax and de-stress is very key to diabetes management, okay? Now, exercise. Also, we talked about how muscle cells don't require insulin when they're active. So if you're exercising, if you're going for a walk, if you're pushing your grandchild on a swing, that is using muscles and allows your body to use the excess sugar available. And that actually allows your cells to use insulin better for 48 hours, so for 2 days after you exercise. So over time, that can stack and actually reduce your A1C. Oh, sorry, we're gonna go back to this for a second. Everyone asks me, what's the best type of exercise? What should you do? And every time I answer, the best type of exercise is the exercise that you will do. So I hate jogging. I think it's the worst. I am miserable before thinking about it. I'm miserable during because I'm exhausted. I'm miserable afterwards because now I have to climb the stairs up to my first floor and my legs are tired. Okay, now I know that it's good for my heart, so I still try. Obviously, I'm talking about how much I hate it, so apparently I still try and do it. But I enjoy yoga. And I will do yoga 3 or 4 times a week. And that strengthens my muscles. It helps me stretch. And it also helps me de-stress. So what I do is I focus on the exercise that I'm going to do. And then when I get ambitious, I try to do the exercise that I hate. Okay, so find something you enjoy. If that's going for a walk at the park, that's actually taking you out of your home, which sometimes can be a stressful environment. So that gets you out of the house, it gets you away from your stress. It lets you just enjoy the outdoors and relax, as well as getting exercise. So if that's what you want to do, that's great. If you want to do Zumba, let me tell you about my Zumba experience. So I went to the Y in Northtown. I tried to do Zumba, and there were all of these women who were amazing. I mean, they could have been professional dancers. I looked like I was having a seizure. Okay, I was just flailing, arms everywhere, didn't know what I was doing. It was a terrible experience, and I didn't enjoy it. So I didn't go back to Zumba because I don't think Zumba's for me. Okay, so try things, enjoy things. There's so many activities that will help manage your blood sugar that you don't have to dislike the whole time. Okay. So up here, you'll also see, and we'll send this out to you guys, you'll see up here how to treat low blood sugar. Now this is primarily if you're on medication that's lowering your blood sugar. Our bodies will actually fix this most of the time. Our liver has emergency sugar packets that it will give to us when our blood sugars get low. But if you're on a medication that can lower your blood sugar, like glipizide or glimepiride or insulin, then you may need to eat some candy, 4 pieces, not the whole bag, or half a glass of juice, and that'll help correct that. All right, so your journey through diabetes, it is important to talk to your doctor about when to check your blood sugar and when to check that A1C. Most people who are on pills should check it daily, first thing in the morning before they eat. Most people who are on insulin have to check it before every single meal, and that's because their insulin may change based on their blood sugar. Okay. Most patients also start off on a medication called metformin. It does have some pretty unpleasant side effects for some people. That's only about a fourth of people. It can cause diarrhea or constipation, not something we like to talk about, but it can. And that usually resolves within a week or two. But I do encourage you, if that goes on, if it's continuing to affect your life, talk to your doctor. There are still other medications. It's not just a jump to insulin. Okay, we want you to have an improved quality of life, not a decreased quality of life. Okay, keep an eye on your A1C, write it down, follow that, and not something you have to obsess about every day, but something you should pay attention to, something you should say, okay, what's a reasonable goal for me? Because when you're making goals, it's not just, oh, I want to have $1 million I just want $1 million. Well, is that even reasonable? Is that something you can do? For some people, sure, that's great. I don't want to quash your dreams. But for most people, it's, you know what? I want to save $500 by the end of the year. Okay. Now that gives us a reasonable goal and a timeline and a way to measure it. How much do you want to save? The thing that it doesn't give us is, how are we going to do that? Okay, how are you going to save $500? Are you going to save $50 every month? Are you going to save $25 out of every paycheck? Are you going to wait till the end of the month and squirrel away $100? Oh, well, $50, sorry. Bad math up here. But you need to come up with a plan of how to achieve that goal, because that is what makes people successful in it. Not a pyramid scheme idea. Just think about, you know what, my A1C is 8%. I would like it to be 7.5% by my next doctor's visit in 3 months, because you do need your A1C checked every 3 months. So, okay, 0.5%. What are you going to do to achieve that? Are you going to start walking 3 times a week? That's reasonable. Don't say 7 days a week, because that's a little difficult sometimes. Okay, are you going to cut the carbs on your plate in half? Say you used to filling your plate up with half a plate of pasta, now you're only going to eat a quarter. Or are you going to talk to your doctor about a different medication? So figure out how to achieve that plan. All right. Now, I know Shanna can provide diabetes education contact information, and you can always meet with us one-on-one if you have more questions than we can answer now. But I am going to open it up to questions for this last 10 minutes. Anybody have any questions, concerns?
Thank you so much, Rachel. I do want to go ahead and let everyone know that we are recording, but if you have a question, you can always put it in the Q&A, and we can get it back to you if it's not one that we want to cover online. I will also give you Rachel's information so that you can contact her yourself. I can share the presentation. I'm hoping to put it on YouTube, because I'm sure the file is going to be a little bit too large for me to email it to everyone. But I will follow up with Rachel's information, absolutely.
Since there are no immediate questions, you can still think of some. I do want to share with you a few tips for the holidays, okay? So I know Thanksgiving is right around the corner, and there are a lot of carbohydrates involved in Thanksgiving. So I want you to talk to your doctor first. Talk to your doctor and come up with a plan. Decide if there's something that you can cut out from the holiday meal that's unnecessary. For me, it's rolls. I don't care about rolls. That's an unnecessary carb. That's an unnecessary food. I'm already too full by the time the rolls come around anyways. Okay, so figure out what you can cut out. Or what some people do is if they want stuffing and mashed potatoes, they'll eat stuffing at lunch and mashed potatoes at dinner, or vice versa. And that can actually help keep those carbohydrates evenly balanced. The last tip that I'm going to give you is my favorite tip. All right. We always go hang out with my husband's whole family, huge family, right? And when we're with all of them, there are children running around all the time. And so sometimes I just need a break from that. Parents need a break from that. Grandparents need a break from that. So you can actually use your diabetes as an excuse and say, you know what? After dinner, I have to go for a walk for my diabetes. So I'm going to go for a walk. And that gets you a moment of peace and a moment of quiet. And then you can come back to your family and really enjoy them again and really spend time with them after you've reduced your stress and after you've walked off a little bit of that sugar. Okay, so talk to your doctor, plan ahead, and find a way to reduce stress and get a little exercise at the holidays. All right, any questions from anybody? Absolutely. Thank you so much, Lisa, for joining. I'm so glad that this was a benefit to you all. I really hope it was. Diabetes, again, is a real passion of mine and something that I want everybody to be able to live a long, healthy life. And so learning how to manage it, being informed is very key. You know, you manage your diabetes 99% of the time. Your doctor manages it about 1% of the time. So gaining knowledge and information and learning how to manage it is very important.